am doing my hip evaluation on Kayla here. Okay, we're gonna start now. Thank you. Hey, Kayla.
How's it going? Yeah.
What happened to you? My name's Tessa. I'm here to help.
I was playing soccer and, just kind of got hit in the hip.
Hit in the hip.
Yeah.
That's it. Okay, so when did this happen, or how long has your pain been?
Probably a couple days, like 2 days.
2 days. Okay. What is your pain on a scale of 1 to 10? 10 being the worst.
Probably like a 4 or 5.
4 or 5. Okay. Have you had any previous injuries on your leg or hip or anything?
No, not that I can recall.
No. Okay. Is your menstrual cycle regular? It's regular.
Yeah, it's regular.
Okay. That is good. That is good. Okay. So have you had any changes in surfaces of training, or have you got new shoes or anything?
Yeah, I got some new cleats, but other than that, the surface is the same.
Okay. So you're fine. You just got hit in soccer.
Mm-hmm.
Okay. So let's take some observations of you. Can you stand up, please? We're gonna look at your hip angulation here. That is from your femoral head to your femoral shaft. There's an angle. Can you put your hands on your hips? Those are your ASIS up there. So let's see. You don't look like you have coxa-valga, which is an increased angle in that area there. You don't look like you have coxa-vara, which is a decreased angle either. So you're looking good. You don't have pigeon-toed, which is good. And you aren't duck-footed. Duck-footed is retroversion. Pigeon-toed is antroversion, so you look good there. Can you lay down? I'm going to check if you have a leg length discrepancy here. Let's see. I'm grabbing your medial malleoli here. They look pretty even to me, so I'm seeing that you're good here. So that's good. Thank you. You can get back up. Okay. So let's see. Let's just start palpating around to see how you feel. Okay. So will you stand up for me? Good. Hands on your hips again. Okay, here are your ASIS right there. Will you turn around for me? That is your PSIS back here. Yep. And along here is your iliac crest from your ASIS to your PSIS back there. And over here is your greater trochanter. When you can feel it around there. Yep. Okay. And you can sit down if you want. Good, and these are your quads up here, so in the middle is vastus intermedius is definitely deep there, and superficial is your rectus femoris on top, and you have your VMO down here, and your vastus medialis medial, and your vastus lateralis is over here, obviously on both sides, so let's flip it over on your stomach. Here are your hamstrings. We got medial is your semimembranosus and your semitendinosus. Lateral is your biceps femoris back here. And none of this is painful, correct?
No.
Okay, so we're all good. We're all good there. You can get up now. Stay seated, and we're going to have to see your neurological abilities, okay? So let's first start with your, dermatomes, sorry. Can you feel L1? Can you feel L2, L3, L4, L5, S1, and S2? Down there, okay, those are normal. Let's do your myotomes. This is L1, L2, up. Out is L3. Foot up is L4. Big toe, L5, down, S1, and S2 is back. That's looking good. Let's do your patellar reflex here. That looks good. That's L2 through L5. Oh, we're going to do this bilaterally too. I did do that bilaterally. Okay. Here's your Achilles, S1, S2. Are we good on both sides here? Yep. Okay. So, I think I'm going to have to test your range of motion just to see that we're all normal here. So first I'm going to have you stand up and flex your knee. Flex your knee, okay. Want to flex your other knee for me? We're going to do this bilaterally. Good, good. That should be about 120 to 130 degrees. That's good. And we're going to do hip extension, so go back as far as you can. Oh, good. That's good. It's supposed to be around 10 to 20 degrees. So we're going to do internal-external rotation, so you can sit on your bottom. And this is actually external rotation of your hip. And that should be about 50 degrees. That looks good.
Okay.
Let's go this way, internal rotation, because that's supposed to be about 45 degrees. That looks good as well. Let's do adduction and abduction. Please scoot back for me and lay on your back. And let's do hip abduction. So move your leg out. Good. That's supposed to be at 45 degrees. It's looking good. And then go on your side for me, please. Good. Leg over here. Put your, yep, there we go. And then move this up. That's hip adduction, which is about 30 degrees. 45, around 45 degrees. Yep. That's good. So now we're gonna go. The 3 ways I could do range of motion could be you could do it actively, I could do it passively, or I could do it resistively. So we're gonna go into some manual muscle tests. Is that okay with you?
That's fine.
Okay. We gotta figure this out here. Okay. Let's do your iliopsoas. Just, move your leg up for me. How does that feel?
That's fine.
Both sides, you're good? All right, let's do your deep external rotators now. I'm gonna provide pressure on this side of your tibia, and you're gonna push in, and let's see, try that. How does that feel?
That's fine.
Both sides? No, go in. There we go. Good job. Okay, we're gonna do your quad muscles now. So you're gonna do knee extension, and then with a neutral foot, can you do that for me? That's good. Does that hurt? Okay, that's for your vastus intermedius and your rectus femoris. We're gonna do it on both sides. Yep, good. Can you move your foot internally and then push out? Good, that's for vastus lateralis. And can you do that? That is for vastus medialis. That is very good. So now we are going to do your hamstring muscles. Yes, please lay on your stomach. So I'm gonna passively flex her knee to 90 degrees, and I am going to externally rotate for her biceps femoris, and I'm going to provide pressure here while she moves her leg towards her butt. Can you do that for me? How does that feel? Good, okay. Can you internally rotate your foot for the semitenosis and semimembranosus? Good. We are also doing that bilaterally. Looks good. Okay, let's do your glute muscles. Let's just do your gluteus maximus right now. Can you move your leg towards the ceiling? There we go. We just tested her gluteus maximus. We did that bilaterally as well. And her gluteus minimus and medius will be on her side. Straight leg, please. And I'm going to provide an adductive force. So try and lift up. There we go. How does that feel? Okay, we're going to do that on both sides. Let's look on your other side. Good. Okay, can you move it up for me, please? Thank you. How does that feel? Good, okay. We are done with those. Let's do some special tests to see how we are feeling, okay? So the first one, since you're already seated, we're going to do the Thomas test. Yes, we're going to do the Thomas test. So what you're going to need to do is grab one of your knees and move back on the table and lean back all the way. And you see how your foot here, your shin, kind of went up, and you can go back down. And you can go either way, and you can do your other one. Thank you. Move, yep. So both your femur actually came off the table too. This test is used for IT band tightness. You can come back down. IT band tightness if her leg kind of comes out. And it's used for iliopsoas tightness if her femur lifts off the table, and her rectus femoris if her foot came out, which it did. So you're looking a little tight there. The next test, let's do the Patrick's test. That's what we're gonna do. You need to lay on your back, please. Scoot up. Thank you. And we're gonna do a figure four, and then I'm gonna provide force on your knee here and on your hip, and I'm gonna push down. Does that hurt?
Yeah.
Yes, it hurts? Okay. Well, we tried that on both sides. Let's try it again. How does that? Does that hurt?
Oh,
Well, that just would indicate that you do have a hip pathology. So you have one. So let's try and figure out, narrow it down. Yeah, let's do Trendlesburg. Stand up for me, please. And what we're going to do is we are going to put your hands on your hips and we're going to lift one knee up like this.
What side do I do?
You can do both. But, that will be your unaffected leg.
Okay.
So, there we go. And let's see. Can you turn around actually? Do it the other way. Okay, try it. That looks good. See, if your glute had dropped, it would mean you have a, it would mean you would have a very weak glute medius on that side. So, okay, let's do, we can do the Eli's test now. Lay on your stomach, please. Okay, and what we're gonna do here is we're just gonna, I can do this leg so the camera can see it. Once I passively flex her leg here, if her hip kind of comes off the table, it would indicate a really tight rectus femoris. It would indicate a really tight rectus femoris, and it does come off a little bit, not too much to be worried about. I'm going to test the other side. And this one definitely does come up. Okay. So, yep, that would indicate you have a tight rectus femoris. Let's do your piriformis test. Lay on your side, please. Either side you want, because we're going to test them both. What we're going to do is this bottom leg's going to be straight, and this one's going to be flexed to about 60 degrees here. And I'm going to press down here on your leg, and you're going to try and resist it, okay? So, yeah, are you trying to resist it? Okay, well, that would indicate a very tight piriformis there, and you can see that she does have one. If we flipped her on the other side, that would indicate, let's try that other side. Well, you can see that she didn't even resist that at all.
Sorry.
Okay, there we go. That one looks better than the other side. All right. So we could do,
I'm so sore.
so I did the Eli's test. Okay, we could do the hip scouring test for you. And if this is positive, it would indicate, labral tear or some OCD to your acetabulum area.
Okay.
So we're going to have your leg a little bit off. We're going to do 3 different degrees of motion here, okay? So I'm going to provide a downward pressure while internally and externally rotating here. And if that hurts, that's putting pressure over here on the acetabulum. That would indicate some OCD. So we're going to... if you hear clicking or popping down there, you could have a labral tear as well. So we're going to do it here, push down, and we could go higher and then push down, and then you could even go down here. And I would also do that one bilaterally. So, yep, I did all the special tests for you. And you do have a hip pathology. Woo! Yep, who knows which one. Thank you for your time.